introduce me. So I'm a project medical referent from Rustenburg in Northwest. And in Northwest, we have been responding to sexual. If you look there on the first slide, you can see it's me, yeah? I'm very pretty, very beautiful. This is the attitude that I would also want you guys to keep up all the time, especially when you are faced with issues of sexual and gender-based violence. The trauma that our beneficiaries are faced with on a daily basis for care or when they are seeking for assistance or help, it is very important that they should find you with a very smiley face, like the one you saw on Cecilia. I think there's a challenge here. Okay. All right. Okay, so just before I can even say about the presentation, I just want to tell you, like, in 2 minutes, what MSF is. MSF is a medical humanitarian organization. It's an international one. It was founded in Brussels, but it has been responding over 70 countries all over the world for all medical disasters. It be also man-made disasters, floods and all that. But in Rustenburg, the response was meant really for sexual and gender-based violence. So what I have here is just to share with you in terms of our project, what we were doing. So the project rationale, it was just to respond to unacceptable equilibrium where victims are underserved by the South African health system. Before I proceed, do we have health officials in the room? Thank you. Do we have Department of Social Development in the room? Okay. Do we also have Department of Education in the room? No. SAPS? Okay, thank you. Yeah, it's going to be a bit of a challenge for me to address most of the critical issues. But yes, I guess all of us that we are here, we would, correctional service? Oh, okay. Okay, all right. Disclaimer, everything that I'm saying here is not really looking at belittling or hammering. Medical people, Department of Health, you know, there's issues of attachment, and a child that is growing with issues of attachment, what happens in the future? 60% of them, what do? They become perpetrators, right?
Yes.
Yeah. So maybe we need to, like, we can't force them, unfortunately. We can't force them. But we need to have programs in place that will assist the single mothers, will assist us as women how to take care of our boy children without the fathers. Can you see we are even becoming shameful of saying, even me?
Yes.
Yeah? That is exactly the point I was addressing, that how many of our beneficiaries that do really speak up? How many? You can also understand that if I can't do it at this level, at this juncture, I'm still shameful of saying yes, you know? Yeah, so because there was a time, I'm just one person, I also just like to, talk with the boys because I have 3 boys. So during our own conversation, I always just talk to them like a mother, a teacher, and all that. And I always ask them, is there any reason when you see someone, you know how boys behave, or men sometimes, I would say. I'm very sorry, guys at the back. I'm not talking about you, I'm just talking in general, yeah? If you feel that you're becoming offended, just say this, then I will understand. Because we still do have great and good guys, really. We still have. It's just one in, in that top of an iceberg that we have challenges. So when I talk to the kids, you ask them, you must look at them when they grow, especially when they start to be 15, 16 teenagers. When one female passes and is wearing a hot pen, what do they do? Exactly. Or they will just give her away, but with that thing that, okay, come and pass in between us. Have you noticed? Where is that thinking coming from? We should ask ourselves that. Where is that thinking coming from? They are already thinking, no, this woman, she's pretty. They are saying it in their own way. She's pretty, but then she must come and pass here so that we can see very well, just to satisfy our own. You see, the selfish aspect is coming in. You are satisfying your own at the expense of the same person because she's being embarrassed. But if you leave her just to pass, even with us, we know very well as females, when you are dressed to kill or in your shorts at the beach and all that, you know what happens. Even the small boys, they'll be like, choo choo, and you're like, what is all this? So this is our world. This is what we need to break from the beginning. That's why I was asking, where is Department of Education? They're supposed to be here and listen to these messages. And I know they are really making a lot of attempts with LO teachers, trying to break up this issue of the perception of young boys at school growing up thinking, no, a woman can be this, a woman must be done that, you have to spank on this. They are, but in essence, what I'm trying to say is that it's only these small things that would make our children to result in something else that we are not even looking forward for. Okay, so now what we did in Rustenburg as MSF, we made a study, we did a survey that was in 2015. So with that survey, we sampled around 800 women in Rustenburg between the ages of 18 and 49. And our aim was just to gather the prevalence of sexual violence, including intimate partner violence within that space, because there is also this thinking that if we are married, the day we said yes to marriage, we agreed to everything. That is true, no? We must start changing it. If it's not going to change, there's no way that also our men will change. And it must be changed by me and you. When he comes back and he tells you that cook for me and finish and all this, you say to him, I have an assignment. If you can cook, I will really appreciate the food. We are laughing, né? Because it's not how it's supposed to be, right? But that is how it's supposed to be. Why? Why I'm saying that? If he's busy and you are busy, what next? You see, it goes back now to the roles and responsibilities. Who said that it's only a woman that must cook for her husband? A husband can cook for you? They can. But then why are you always saying, no, let me just quickly cook? When he comes back, he must find the fresh food. I'm going to try and even make some salad because he likes salad. You see, the issue of socialization, that's where it comes in. Hence, that's why with Department of Education, they do have those programs. That's why I was talking about social development. The upbringing of a child, saying that there's no role and responsibility for women. Both, we can still do that. Imagine with a boy that will not have luck of marrying anybody. So he's going to be asking for who? For food. So you will blame yourself for that. So those are the kind of aspects that we need to be looking into as well, to say the socialization is the key aspect of where we should really start with issues of gender-based violence. Other than that, if we miss it there, I'm telling you, if we miss it there, it's going to be a challenge for future. For future. Some of you, they will tell you, no, I see these things and I live within the community. When you knock off, you pass by the garage, you buy 2 newspapers. You say, no, when he comes back, he's going to read the newspaper. And you, as a maid, you are going to cook now. Seriously. It's more like a norm, right? No, it's fine, I will cook. Then he will just sit there and read the newspaper, or maybe just come in and say, okay, I'm coming. Let me see the boys where I'm coming. And when this happens, you already have your boys, you have your girls. So when they grow up, they are picking it even from the family aspect that no. I saw it. Even my father, when he come back, is just going to sit on the sofa and read a newspaper. It's mommy that has to go into the kitchen and cook and give daddy the water to wash the hands. I don't do that. Okay. Yes, I'm breaking that one. I don't do that. If I cook, I tell him to give me water to wash my hands. I cooked. I did my part. So he must also do his part. So he must give me water, let me wash my hands, and enjoy my food. Even after finishing, he must do something else. Or when you cook, you ask him, he's coming to make vegetables for you, then you cook with him. Why not? It's possible, ne? Okay. This one is going to give me a challenge. Okay. So now with the findings of the study, I'm just going to run through the study because I was part of the study. I do know what were the findings. They were so alarming. From the 800 women that we included in the survey, 1 out of 4, they were raped in their lifetime. I said from the age of 18 to 49. The reason why we took 18 to 49, we could not, get from the age of 50 and above. So because of so many reasons. And out of that, 1 in 3, they also had a miscarriage because of rape. And 1 in 3 again, they had issues with mental health related to them being victims of rape. So now, having said that, then we, MSF and the department, we had to sit together and share the results, and we came up with the concept of a response model that is called a Khomotso Care Center. It's not coming back in between. Okay. So with the Khomotso Care Center, this is just a rough map to show you in terms of the district where we were working. We are in Bujanala district, and we're responding in the 2 sub-districts, Rustenburg and Madibeng. You can see in Rustenburg and Madibeng, there's also a lot of community health care centers that you can see around there. So having said that, we came up with this rationale that let's respond to the issues of sexual and gender-based violence as identified from the study, and trying in a way to bridge up the gap of no access. And out of that, the other thing that we depicted from the study was that 95% of the women, they did not seek any medical care. And you can already understand if you don't seek any medical care and you are a victim of rape, what happens? There is already transmission of HIV. There is already transmission of STI. Unwanted pregnancy is also very critical because then you will become a teenage mother. And what happens when you are a teenage mother? A lot of things do happen. And also looking at the socio-economic status of our own brothers, sisters, and ourselves, we are not yet there. Yeah? So those were the findings, and in trying to respond, that's where we came up with this model. If you look at it there, you will see it's a Homotso Care Center model of care. Homotso, it's just the meaning of Tutuzela. It's a comfort center, right? How many of us here know Tutuzela? Okay. We know very well that Tutuzela is a national model for responding to issues of gender-based violence, sexual and gender-based violence. So with our one here, there was also a critical issue of access. We know very well Tutuzela is always attached to the hospitals, right? And when we're talking about geographical access, how many of our hospitals can we walk to? Just asking, yeah? So this one, it's a complementary model, and it's also referring for advanced care at the Tutuzela. But then it's at the community healthcare centers. Remember the level of care? We start from primary health care, then we have the community healthcare center, then it be district hospital, then provincial, then at the provincial they also have to be tertiary. Then we start talking about advanced care, right? So this is the second level of care where we establish the Homotso Care Centers. Okay, if you look at that model, you will see there is 2 houses. So the 2 houses, one is just the center in itself where we were working. And this center, within the center in itself, we're responding comprehensively. I know where we are sitting, we already know what are the path that a victim would go through. There's elements of trauma, you can have physical injuries, yeah? It could be that the perpetrator is also at home. So it's already telling you by that you need to see a medical person to address your medical issues. You need to see a registered counselor or a psychologist for your mental issues. You need also to see a social worker because I'm coming from a home, I'm coming from a society. And that environment needs to be conducive enough for me to go back to it. So apart from the center in itself, you can see that there is also other areas of advanced referral. And the one down, which is very critical, is health promotion. It is very critical that anywhere in the world where we respond, we need to look into the aspect of health promotion. In social development, I know you have the community development workers that go into the community, right? Yes. In Department of Health, we also have community healthcare workers. But what we noted was that the community healthcare workers, during their trainings, there's nothing that involves issues around responding, just even to a person saying, I'm raped, what should I do? Hence, we were able to address those issues. We trained more than 400 of them into responding to these issues, and we even trained them on psychological first aid.
1 minute left.
Okay. If you look at the second house, when you are dealing with issues of gender-based violence, especially for women's health, there's no way that you should leave the sexual and reproductive health, out of your sight. In between, it's the bi-directional that I wrote there is because you can get a person from SRH, a 15-year-old reporting that she's already pregnant, and when you assess and screen that person was raped by somebody, speaking about statutory rape, even if a person gives consent, if the age gap between herself and the partner is more than 4 years, that is already a crime. So all those kind of things. So that's why it's very important to make sure that you also have access to termination of pregnancy and also STI and advanced STI management as well. Okay, it doesn't want to move.
Please conclude.
All right. So with the conclusion, I will jump this one. Okay, it's fine. This one is jealous, doesn't want me to talk about the key issues here. All right, so I will just come to the key reflections. Having said that, with the same model that I spoke about, we still have issues as a country to address. The first one is about the forensic nurses that are not recognized as specialty by their own regulatory body, which is South African Nursing Council. But yet they are doing quite a number of, I always say, they will always say, yeah, she's saying that because she's also a forensic nurse. But I'm not just a forensic nurse. I also did forensic nursing. And I have witnessed the work that they are doing that is very critical to have them. And once in any community healthcare center there's no forensic nurse, there will never be this service. There will never be this service, believe me. We have a cadre called registered counselors. Registered counselors are seen as independent practitioners and they are endorsed by the HPSCA. But we don't have them anywhere in the staff establishment for any department. Be it Department of Health, be it DSD, be it Department of Education. No, we forgot about them. And you remember the unemployment rate in South Africa is at what percentage? So are we not the cause of that? Because we do take our kids to go and do B-Psych for 4 years. When they come back, then they are just very key to increase the uptake. This is exactly what I was saying, that the ground has to be ready before you can even start with the service. The need of training of the CHWs really on GBV is very critical as well, because if you don't really, it's going to be chaos. When they go into communities and they find situation, they don't even know that this is gender-based violence. And the earlier the referral, the better, because we can take, along the victim to become a survivor. DSD, VEP program, I really like that program. But it's just about running the program. I want to be frank. I have been in so many platforms of VEP, we were just running the program. We were leaving behind the survivors. So let's also revisit the POA and look at how best can we ensure that we are more on the survivors rather than really on the, We have a correctional service that is offering 100% programs for the perpetrators. But if you look at our survivors, there's really nothing. Right, the KCC, TCC referral, it should be very much strengthened so that we can be able to have that access of advanced medical care as well. My time is up. I want to thank you and I want to leave you in peace. Thank you.